Hello my dear friends, welcome to Forensic Medicine by Dr. Paras, and now we are going to talk about chapter number 5, that is Thanatology and the Postmortem Changes. Word Thanatology means death, so we are going to talk about the death, different finding after the death, what you are going to see that will help us in telling the time since death and etc. things. Now first thing is death. Definition of death was given by Declaration of Sydney. The first thing is, who defined the death? Death was given by the Declaration of Sydney. And what is death actually? So three things you need to see, those are completely closed. One is circulation, then brain function, then respiration. If your brain function is stopped, my dear friend, if your brain function is stopped, that is called as coma. The patient is in what, sir? Coma. Patient is in coma. And if circulation is stopped, the patient will be in syncope, my dear friend, because all the respiration has stopped now. And respiration, if it is stopped, we call that as asphyxia, my dear friends. So if your heart, if your heart, lung and brain stop working, we call it as at Bishop's tripod. Bishop's tripod. If your heart, lung and brain stop working, we call that as a what's a Bishop's tripod, my dear friends. Now the type of death, if we talk about, there are two types of death. What is somatic and the clinical death? In the somatic or the clinical death, your heart, your lung and your brain stop working. Now, moment your heart, lung and brain stop working, you will see your circulation is now stopped. That means your cells are not getting the blood supply in blood, they are not getting the oxygen. If the cells are not getting the oxygen, after some time you will observe that the cells start dying, my dear friends. If the cells start dying, that kind of death is called as cellular death. So in short, if I can explain you, somatic death is happening right now. Cellular death will not happen immediately. It will take some time. So there is a time gap between the somatic death and cellular death that is called as supravital period. This is called as what, sir? Supravital period. Supravital period. So two type of death. One is somatic, another is cellular. Now let's briefly explain the somatic death, which is also called as clinical death. Cessation of what vital process? What are the vitals? Sir, heart, sir, lung, sir, brain. These are the vital organs. If your heart, lung and brain stop working, this triad is called as Bishop's tripod. If all those three things, one is your heart. If your heart will not work, your blood will not be pumped. Lungs not work, no oxygen. If your brain stop work, all the body organ will be helpless. All the body organs will be numb like this. So my dear friends, person is declared dead, but the cells are not dead. Only person you can declare. A person is coming to you in an emergency department. A person is coming to you. You have checked the pulse, you have checked the pupil, you have checked the respiration, etc. You will find every vital sign absent. Don't declare death. Get ECG done. When on an ECG, if you see the flat line coming, my dear friends, once you observe the flat line, after that only you consider that person is dead and declare death after that only, okay? So here person is declared dead, but the cells are not dead. That is called as clinical death. That is why this is called as what's a clinical death, because cells are yet to die, but the vital organs like heart, lung and brain already stopped working, my dear friends. Now the cellular death. Now the cells started dying. There must be a time gap between the clinical death and the cellular death, my dear friends. All cells in the body dies after the cessation of Bishop's tripod. And what was Bishop's tripod? Again we are talking about the heart, lung and the brain. Heart, lung and the brain. Now between this somatic death and the cellular death, my dear friends, there is a time gap. This time gap is called as supravital period. The time gap between somatic death and the cellular death is called as supravital period. This is also a golden period. Why this is golden period? Because if you need organ donation or harvesting an organ, cadaveric organ harvesting, my dear friends, this is the best time, because if we give stimulus, if the cells are alive, they respond, they do respond. If person died just now, you need to preserve organ harvesting, you have to transplant the organ, etc., etc. This supravital period, whatever the time is between the clinical death and the cellular death, this is a golden time to get the organs out, my dear friends. Example, how to check it, whether the cells are responding or not responding, my dear friends. There would be a phenomena called as Zasco's phenomena. What is Zasco's phenomena? Zasco's phenomena is used to check the tendon's reaction. So what you are going to do here, striking the lower 1/3 of the quadriceps, 1/3 of the quadriceps tendon, once you are striking, you will see the upward movement of the patella. On striking on the quadriceps tendon, you will see the patella is moving outwards, upwards, like this, my dear friends. This is Zasco's test positive. Why it is able to move? Because cells are still alive. Cells are still alive. That is why he is producing the movement. Okay. Now, what is suspended animation, my dear friends? The next topic is suspended animation. Person is alive but looks dead. That is temporary cessation of the vitals. Temporary cessation of the vitals can be voluntarily and can be involuntarily, my dear friends. So what are the things which are seen in which this suspended animation is associated with? So my dear friends, what is this? Person is alive but looks dead. Yes. Temporary stoppage of the life signs. What are the life signs? Person is breathing, circulation is there, pulse is coming, the pupils are reactive. These are the life signs. But if these signs are absent, we consider that as person dead. But after resuscitation, apparently dead, but after resuscitation, if life is coming, that means this was the case of suspended animation. Whatever the thing was, whatever the suspension was, it was temporary suspension. That is why this is called a suspended animation. Now, condition in which suspended animation is seen, my dear friends, the very famous mnemonic is there. New HD TV. New HD TV, my dear. New HD TV. My God. So this is new. This is HD, this is TV. This sequence we need to go with up and down. So new HD TV, newborn person. Newborn, we can see the suspended animation. Baby is not crying when baby is born, but after some time, after compressing, etc., baby start crying again. Then this is suspended animation. Electrocution, we see in case of electrical injuries. Person suddenly collapses and after some time it again comes back. Whenever we put that person on the ground, moment the charge is released from the body, the vitals will again be appearing. Now next is wasting diseases like cholera, TB. Wasting disease, what do you mean by wasting? Wasting means loss of muscle mass. Muscle mass, cholera patient, lot of diarrhea, lot of dehydration. If lot of diarrhea, lot of dehydration, muscle mass will be gone. TB, prominent feature is there. Weight loss. Weight loss is there. So these are the three things new. Then HD is heat stroke, hypothermia. Again dehydration is there, my dear friends. Then coming to the drowning patient also. Drowning person also. The person was inside water, life was cessated. The vitals were cessated. Once we pull that person out, we started removing water from the abdomen. We started giving the CPR, chest compression, mouth to mouth breathing. Suddenly person is again revived. This is suspended animation, my dear friends. Other than that, typhoid. In typhoid also, you will see the patient is dehydrated, weight loss is there, diarrhea is there. In those conditions also, once we treat, there are chances that person will come alive again. Voluntarily, this is voluntary. All of them were involuntarily, this is voluntary. Yoga practitioners, highly skilled yoga practitioners can do this. Tapasvis, etc. can do this. They can make themselves dead for some time. They might appear dead. but they will again come back. This is again a very important point to remember here. So what we have learned, my dear friends, here, new HDTV, new for newborn, yes, E for electrocution, and W for wasting diseases like cholera, TB, and H for heat stroke or hypothermia, D for drowning, then T for typhoid, and sir, V for voluntary. Voluntary is seen in the yoga practitioners. So these are the conditions which were associated with the suspended animation, my dear friends. Postmortem changes, immediate changes, early changes, late changes, three type of changes we are going to study right now, sir. Immediate changes, if we talk about, number one is loss of voluntary movement. How there will be loss of voluntary movement? If your brain stop working. Brain stop working. Loss of circulation, how? Your heart stop working. Heart stop working. Loss of respiration, your lungs stop working. So first of all, these three vital organs will stop working. These are the immediate changes you are going to see after the death, my dear friends. Now coming to the early changes. Early changes in the eyes, you are going to see the Kevorkian sign, Trachea. We'll be discussing about these two signs, my dear friends. Don't worry about this. And now we have to talk about the early changes, more early changes, and those are Rigor Mortis. Sir, word rigor is telling you something. Rigors mean rigid. Rigor means what, sir? Rigid. That means rigidity is there, so there will be a stiffness of body. Livors means something living. Living life is colorful always. So color change in a body is called as Livor Mortis. So these definitions should be very much fit inside your head, my dear friends. Then we have to talk about Algor. Algor, you remember this, LG. LG company is making fridge. So fridge is known for decreasing the temperature, so decrease in body temperature. This is just to remember the names. Postmortem caloricity. Calorie is burning, that means heat is produced. Heat is produced, that means body temperature is increased. So four terms with me, my dear friends. Rigor mortis. Stiffening of body is called as rigor mortis. Why it is happening, we'll be discussing individually one by one all of these. Livor mortis, color change in a body. Algor mortis, decrease in body temperature. Postmortem caloricity, increase in the body temperature, my dear friends. Now, late changes, my dear friends. Decomposition, putrefaction, autolysis. What is decomposition? All of the changes which are externally seen in the body, this is called as decomposition after the death. External changes in the body is decomposition. Putrefaction is the internal changes in the body. Putrefaction is what, sir? Internal changes in the body. What is autolysis? So, lysis of the body by its own enzymes. So, three things in the late changes: decomposition, that is external changes; putrefaction, internal changes. There will be some enzyme, there will be some bacteria who is eating body from inside. There will be a climate factor who will be eating body from outside. If eating body is from outside, this is called as decomposition. And if our own body enzymes are eating own body, this is one type called as autolysis. Okay? Now, early changes. Let's completely discuss everything. First of all, if we talk about the early changes, in early changes, we would love to talk about the eye changes first. So, in eye changes, first thing is retina. So, what is happening in the retina? There is a segmentation. Segmentation of the retinal vessel is seen because blood circulation stopped after the death. Once the blood circulation stops, there will be segmentation. Segmentation. And this looks like a railway track, my dear friends. This looks like a railway track. That is why this is called as what, sir? Railroad phenomena. This is also called as what, sir? Railroad phenomena, or in the other fancy terms, if we have to take the name, we can take name as a Kevorkian sign. We can take name as what, sir? Kevorkian sign. So you will see right here, sir, retina. What is happening in the retina? Segmentation of the retinal vessel is seen because blood circulation stopped after the death. because that is the earliest thing which is happening, my dear friends. Now, it looks like a railway track. This you can see, this looks like a railway track. That is why this is called as railroad phenomena. Makes sense. And the other name is Kevorkian sign. This is what we are going to see in the retina, in the eye changes, my dear friends. Now we see in the cornea. What changes in the eye, in the cornea you are going to see. So cornea is basically transparent. Basically transparent structure is there. Who is maintaining the transparency of the cornea? It is keratin sulfate. Keratin sulfate is maintaining the transparency of the cornea, and cornea is a avascular structure. Cornea is a avascular. The only structure in the eye which is avascular is the cornea, my dear friends. So what happens after death? It becomes hazy. It becomes hazy, like a steam deposited. Steam deposition, like that. But my dear friends, after 6 hours, the hazy cornea get opacified. It looks like a cataract right now. So after 6 hours, you will observe your cornea will be opacified, my dear friends, after the death. Okay. Now coming to the third one, that is sclera. Sclera is what? Sclera is a white part of the eye. White part of the eye. White part of the eye is called as sclera. So my dear friends, if we see sclera right here, what is deposited? The deposition of epithelial and the cellular debris in the sclera is called as trachinoid. The shape is triangular. If you can see here, sir, the shape is triangular. Triangular shape deposition of the epithelium and the cellular debris in the sclera will make a tachinoid, and the time appearance of a tachinoid is 3 to 6 hours after the death. So this can actually help you in calculating the time since death, my dear friends. This can help you in calculating the time since death, my dear friends. So this is also called as a trachinoid sclerotica. Sclerotica, trachinoid sclerotica is the other name we can use for this, my dear friends. I hope this is very much clear to all of you. Now we'll be moving on something called as intraocular pressure. The fourth finding we are going to find inside the eye, my dear friends, that is intraocular pressure. If we talk about the normal person, my dear friends, in the normal eye, the intraocular pressure is 10 to 21 mmHg in the normal, or you can say living person. Living person, my dear friends. And if in living person, the intraocular pressure is more than 21 mmHg, we call this condition as glaucoma. And glaucoma is the second most common cause of blindness, my dear friends. Now we talk about the after death wala thing. So what it says, after 2 hours, it becomes 0 mmHg. Earlier, normally, if a person is alive, it is 10 to 21 mmHg, which is a normal intraocular pressure. How to measure normal intraocular pressure, my dear friends? We measure with the help of tonometry. Which is the best tonometer, my dear friends? If someone asking you best tonometer, Goldman. Goldman applantation. Goldman applantation is the best, my dear friends. So you notice right here, after 2 hours it becomes 0. That is why it is helpful in calculating the time since death, TSD. Time since death, my dear friends. So 4 finding we have just seen in the eye. Fifth one we talk about what, sir? Fifth one we talk about the vitreous humor. Sir, you know the volume of eyeball is 6 ml. 6 ml. I'm sorry. It is 6 ml. And guys, out of 6 ml, 4 ml is vitreous humor, and this vitreous humor is present by birth. This vitreous humor is present by birth. And after death, it increases, my dear friends. So after death, it increases. Why? Because of increase in potassium level in the vitreous. So after death, your vitreous humor, whatever the volume was there, the vitreous humor will increase, my dear friends, because of the extra potassium which is coming inside the eye. Normal volume was 4, and if it is more than 4 ml after death, that means it will clearly tell you now the person is dead. Now my dear friends, 5 signs which we have read so far, I just want to revise with all of you. So first eye changes we have seen right here, sir. First eye changes what we have seen? Eye changes we have seen in the retina. Retina ke andar we have seen the segmentation of the vessels. Railroad phenomena was seen. What was seen there, sir? Railroad phenomena was seen. This sign is also called as Kevorkian sign. Coming to the next thing is cornea. Cornea is normally transparent, we all know. Cornea is a avascular structure, we all know. And after death, it becomes hazy in 1 hour, which can help us in calculating the time since death. After that, it becomes hazy after 6 hours. This is also helping us in calculating the time since death, my dear friends. Then coming to the next thing, that is sclera. What is sclera? Sclera is the white part, my dear friends, of the eye. What is deposited? The epithelium and the cells, the debris is deposited. Triangular shaped deposition is there, and appears 3 to 6 hours after the death. What is the color? Color is brownish black in color. Okay, sir. Now coming to the intraocular pressure, the fourth thing is intraocular pressure. Normal intraocular pressure is 10 to 21 mmHg. How to measure this normal intraocular pressure? With the help of tonometer. Which tonometer is best? Goldman applantation, my dear friends. After 2 hours of the death, it becomes 0. So this will also help us in calculating the time since death. Vitreous humor. The normal eye volume is 6 ml. Out of 6 ml, 4 ml is your vitreous humor. And guys, after the death, you will see there is increase in potassium. Because of increase in potassium, your vitreous humor will increase in the eye, my dear friends. So these are some 5 signs you have read so far in the eye. Now we'll be moving on to the temperature. So eye is clear. Now we'll be moving to the temperature changes. So temperature changes, number 1 term is very, very important right here, sir. That is Algor Mortis. So Algor Mortis, I told you these 2 words you need to pick right here. If I write here LG company is making the fridge. Fridge will decrease the temperature. This is just a mnemonic to remember. And this is also called as post-mortem chill or cooling. Algor Mortis is also called as post-mortem chill or cooling. What is happening? There is a decrease in the body core temperature, my dear friends. So most common site for the body temperature is rectum. Most common is rectum, my dear friends. But there are exceptions to this, my dear friends. Exception to this is sodomy, love, or buggery. This is penile anal intercourse. If rape victim is there, this is example of unnatural sex. If rape victim is coming to you and death has happened and you have to check the core body temperature, then you can't use the rectum route because already sex has happened on that route. So that route will not be a good option at that time. So exception is there. Exception is sodomy, love, or buggery. What is that buggery? This is penile intercourse, my dear friends. Other than that, if someone is asking you about the ideal site, if someone is asking you about the ideal site for the body temperature, then perihepatic space around the liver, my dear friends. If this is a liver, around the liver, my dear friends, around the liver, whatever the space is, this space is called as perihepatics. I know my drawing is very beautiful. Okay? So perihepatic space is there. Instrument uses thanatometer. The instrument is called as thanatometer. Length of thanatometer is 25 centimeter long. 25 centimeter long, my dear friends. And calculate between 0 to 50 degrees Celsius. It can calculate between 0 to 50 degrees Celsius, my dear friends. Now, body temperature decreases 15 minutes after the death, which is very normal. After death, the body temperature starts decreasing after 15 minutes of the death. This is also helping in calculating the time since death. Contributory factor, which is helping in calculating the time since death, my dear friends. Okay. Now, my dear friends, other instrument which we can also use is a chemical thermometer, which is also 25 centimeter long, my dear friends. These all are the instruments which are used to calculate the Algor Mortis. What is Algor Mortis? Decrease in body temperature after the death. When it start decreasing 15 minutes after the death. An instrument thanatometer, yes, 25 centimeter long. Calculate between 0 to 50 degree. If someone asking you most common site of body temperature measurement, then it is rectum, and ideal site for the body temperature would be the perihepatic space, my dear friends. Now we moving up the Algor Mortis curve, which is sigmoid shape. What is sigmoid shape? You will see first there will be a slow decline in the temperature. After that you will see the curve is declining like this. This is rapid phase, second phase, and third again there is a slow phase. So slow followed by rapid, rapid followed by slow. This is all about the Algor Mortis, my dear friends. The curve is what, sir? Algor Mortis. The shape of curve is sigmoid curve, my dear friends. So Algor Mortis curve is sigmoid in shape. First there is a slow decline, then there is a rapid decline. After that again there will be a slow decline, my dear friends. Now let's see what is the rate of fall in temperature. So it depends according to the season. If, my dear friends, we are in summer, the dead body is in summer, the rate of fall is bit lower as compared to the winter. Already cold is there, so rate of fall would be more as compared to the summer. If I talk about the summer, the rate of fall is 0.5 degrees Celsius per hour. With this rate, body temperature will start falling. And in Algor Mortis, guys, remember the fall of temperature start after 15 minutes. In winter, it is 0.7 degrees Celsius per hour. In winter, it will be what, sir? 0.7 degrees Celsius per hour. And this is also helping us in calculating the time since death, my dear friends. Now, we'll be talking the next topic. Next topic is calculation. Sir, time since death. How to calculate time is normal body temperature minus rectal temperature upon a rate of fall. This will give you the timing, and that will help you to calculate the time since death. If someone asks you what is a normal body temperature, normal body temperature, if we have to talk about, my dear friends, normal body temperature is 98.5 degree Fahrenheit. Now, the next topic what we are going to start is postmortem caloricity, my dear friends. Calorie, the word calorie is telling you something, it is related to the heat. Word calorie itself is telling you that something is something related to the heat. Special condition in which body remains warm for first 2 hours. Normally what happens, after 15 minutes your temperature start declining. That is Algor Mortis. But in special cases, special causes of death, there will be increase in temperature. That too for the first 2 hours of the death, my dear friends. That is called as postmortem caloricity, my dear friends. Now, what are the examples? What are the different examples which we have to study right here, sir? So, condition which increase the bacterial activity. For example, cholera, septicemia. So, these are the condition which can increase the bacterial activity. Then increase muscle tone. The condition. So, this is a main condition. This is a main condition right there, sir. So, 3 main conditions are there. You need to focus right here. Condition which increases the bacterial activity. Cholera, yes, obviously. Cholera, we all know the bacterial activity is more. Vibrio cholerae, rice watery stool is there, and that would lead to the dehydration and patient will die eventually. Septicemia, all the bacterial activities are happening, and because of that septic shock has happened. In those scenarios, first 2 hours body temperature will be high. Now coming increase in muscle tone. Muscle tone is too high. Too high muscle tone, too much of stretching of muscle, too much of shrinking of muscle, that will lead to ATP breakdown. ATP breakdown, heat is generated. So there could be a tetanus. You all know tetanus. Tetanus, who is mimicking tetanus? Strychnine poisoning. Strychnine poisoning mimics the tetanus. In both of them, the cause of death is respiratory muscle paralysis, RMP. Respiratory muscle paralysis, my dear friends. Next thing is failure of heart regulation. Failure of heart regulation, if we talk about sunstroke, pontine hemorrhage. So these will lead to, failure of heat regulation. The correct word is heat regulation. Sunstroke, pontine hemorrhage, etc. These will lead to heat regulation, will stop regulating in the body, and person will die. In sunstroke, etc., the keyword sweating is absent. Sweating absent, my dear friends. Done. Now with third changes, we are going to talk about the skin changes. Skin changes, if we see, we are going to talk about the color. So color is Livor Mortis. Living life is colorful, my dear friends. Livor Mortis. Livor Mortis is also called as postmortem staining. Postmortem staining or postmortem lividity are the different names we are using for the same term, my dear friends. Now, what is the mechanism of Livor Mortis? It's very interesting to know the mechanism. Sir, after death, what will happen? The blood will start pooling in the dependent area. What are the dependent area? The area which is not touching the ground. Dependent area, the area which are not touching the ground. For example, this is a hand. The area which is touching the ground will exert a pressure. There will be a pressure. With the pressure, the blood which is there, which is touching my fist like this, all of the blood will pool onto the other area which is not touching the ground. So result in staining, bluish purple color is there. What type of staining will be there, sir? Bluish purple color staining would be there. And this bluish purple color staining is because of deoxyhemoglobin. Deoxyhemoglobin, my dear friends. Done. So when we are going to see? We are going to see this Livor Mortis 1 to 2 hours after the death. So this is also helping in calculating the time since death, my dear friends. Now coming to the next topic. Next topic is same only because it is starting after 1 to 2 hours. It will not be possible that the peak will come after 1 to 2 hours. The more visibility will happen after 4 hours and maximum by 6 to 12 hours. Start after 2 hours, more visibility, 4, maximum 6 to 12 hours, my dear friends. If I show you this image, you can very well see here, these areas which are white, they are touching the ground. And those areas which are purplish bluish in color, those areas are called as dependent areas. Those areas are called as what, sir? Dependent areas. That areas which are not touching the ground. Now, in which scenarios you will see Livor Mortis absent, my dear friends? So, Livor Mortis is absent in drowning. Why it is absent in drowning, my dear friends? Livor Mortis is absent in drowning because in drowning, continuously body will be moving. That is why pooling of blood is absent. And when pooling of blood is absent, there will be no Livor Mortis. Then no Livor Mortis. Livor Mortis. It is also called as postmortem staining, my dear friends. Now, in hanging. So, drowning we have learned. Now, in hanging. In hanging, Livor Mortis is seen in the areas which are under the influence of gravity. Maximum influence of gravity. So, it would be seen at the hand, foot, penis and the lower part of the face. So, 4 areas you have to focus. If person died because of the hanging, my dear friends, after 2 hours you will see it will start appearing. 4 or 5 hours it will be maximum. It will start be more visible, and after 6 to 12 you will see the maximum phase coming now. Now, you will see in this condition in the hanging in the 4, that is hand, this lower part of the face, you can take this jaw, then coming to the penis and the foot, my dear friends. Now the important part right here. Sir, if the body position is changed within 7 hours, body should be lying at one place. Homeostasis or stability is needed if you need to see the Livor Mortis. If the body position is changed within 7 hours of the death, the site of Livor Mortis would be shifted to the secondary site, my dear friends. So, if Livor Mortis is here, it will shift to the other side. On which side the body is shifted, again the dependent part will get the color, my dear friends. So, let's see the position, and according to that position, which part is a dependent part and which part is not. Now, if the supine position, now what is supine position? If a body is lying like this, my dear friends, this position is called as supine position. And if you are lying like this, Your head down, face is down, head is up, back is upward. That position is called as prone position. So two positions are clear. Now putting this thing in the mind, supine position, if we talk about, dependent parts are back of chest, abdomen, legs which are not touching the ground in the supine position, my dear friends. In the prone position, front of face, chest and abdomen and the legs are the dependent part. So if you will be like this, your dependent part would be back of the chest. Here will be abdomen, back of the abdomen, and the legs, back of the legs which are not touching the ground. And in prone position, you will see front face, chest, etc. Those will be the depending part, my dear friends. Now the color is very important. If you check here, the color will tell you the cause of death. A very important table to remember, my dear friends, forever in your life. Sir, if carbon monoxide poisoning is there, you are going to see the cherry red color. But in the normal death you have observed, because of deoxyhemoglobin, the color was purplish bluish color. That means there is no other contributory cause. But if there is a cherry red color of the Livor Mortis, then you have to suspect something of carbon monoxide poisoning, my dear friends. Next thing is cyanide. If you see the cyanide, there will be a brick red or bright red color. Brick red or bright red color. Third is hydrogen sulfide. Hydrogen sulfide, bluish green color would be there. Opium, my dear friends, there will be a black color. So 4 are here. Rest we will be deciding right now, learning right now, my dear friend. So if the person is dying because of the hypothermia, bright pink color would be there. And if person is dying because of the benzene, alanine nitrate, BAN, benzene alanine nitrate. So you have to ban the chocolate. So remember, dark brown chocolate color, dark brown color, or you can say the chocolate color, your favorite chocolate color. Okay, sir? And if Clostridium perfringens would lead to the gas gangrene, then the color would be brown. So let's revise these things, my dear friends. They're very important for the table for the exams. So carbon monoxide, cherry red color is there. Cyanide, bright red or brick red color is there, my dear friends. Hydrogen sulfide, blue green color is there. If we talk about the opium, black color. Hypothermia, bright red color is there, my dear friends. Bright pink color is there. If we talk about the benzene, alanine and nitrate. Benzene, alanine and nitrate, my dear friends. Benzene, alanine, dark brown or chocolate color is there. If we talk about the Clostridium perfringens, bronze color would be there, my dear friends. Now body tone changes. The next is body tone. If we talk about the body tone changes, there will be a rigor mortis. And word rigor will tell you about the rigidity. Word rigor will tell you about the rigidity, my dear friends. It is also called as cadaveric rigidity, my dear friends, because after that there will be a cadaveric rigidity. Why there is a cadaveric rigidity? Because there is decrease in ATP. Very important point to remember. Cause of stiffening of muscle is happening. Why? Why the muscle are rigid? Why they are stiff? Because there is decrease in ATP. What is the first site from where this is starting? From where all this process is starting? The first site of rigor mortis would be myocardium, my dear friends. Myocardium. And first external site is eyelids. If nothing is mentioned, only they are asking about the first site, then your answer would be myocardium. Specifically, they are asking you the internal site, then also myocardium, external side, then eyelid. So myocardium is first site of rigor mortis plus first internal site of rigor mortis. Now there is a rule which is followed by the rigor mortis, my dear friends. What rule rigor mortis follows? You will see Niston's rule is there. Niston's rule says it will start from the eyelid and it will go to the toe. From eyelid till toe, the rigidity will happen. So this is Niston's rule. Let's see which path it is following till it goes to the toe, my dear friends. From eyelid, it will go to the jaw. Eyelid to, it will go to the jaw. From jaw, it is coming to the neck. Eyelid to jaw, jaw to neck. Imagine along with me, eyelid, jaw, neck. Then whole of the face is involved. After face, what comes? A chest. After chest, upper limbs are there. Along with me, again sir. Eyelid, jaw, neck. Full face is involved. Chest is involved. After that, upper limbs are involved. Other than that, sir, let's see. Other than that, you will see abdomen. After chest, abdomen, then lower limbs, then feet, and then it will go to the toe. So sequence is very much clear in our head right now, sir. Another rule Rigor Mortis will follow, that is very interesting rule, that is called as rule of 12, my dear friends. So what is rule of 12? So 12 hours it will take to involve all of the organs. Whatever distance rule we have studied right now. So you will see all of the organs are involved within 12 hours. 12 hours it will stay, and after 12 hours it will disappear. 12 hours it will involve all the organs. 12 hours it will stay. 12 hours it will disappear. This is rule of 12 and the distance rule, my dear friends. Now, what are the factors which are influencing the rigor mortis? What are the factors which are influencing the rigor mortis, my dear friends? The condition. If we see the fetus less than 7 months, rigor mortis not seen. Why? Because lots of fat is there. Okay, that is why muscle mass is less and it is not seen. Not applicable for the fetus less than 7 months. Violent death, for example, murder. Murder के अंदर, in murder you will see rigor mortis early and short. In murder you will see the rigor mortis early, very early you will see, and it will be short for very short time you will see. Strychnine poisoning, strychnine, nux vomica, which will actually mimics the tetanus, my dear friends. Again it is early and long. Now arsenic, if we talk about sir, arsenic it is late and long. Arsenic mein it is late and long. If we talk about the summer season, early and short. So murder also early and short. Winter season, late and long. So remember this table, my dear friends, what is written right here. So you will see right here, sir, fetus less than 7 months, not applicable. Violent death, for example, murder we have taken early and short. Strychnine poisoning, early and long, my dear friend. Arsenic and the winter season. Arsenic and the winter season are same. What are they? Late and long. Winter is again late and long. Summer season, it is early and short, my dear friends. What are the condition that looks like rigor mortis? Condition that looks like rigor mortis would be cadaveric spasm. The condition which looks like rigor mortis, mechanism of action is same. What same? Decrease in ATP. The main culprit is decrease in ATP will lead to the muscle stiffening. It is also known as instantaneous rigor. Instantaneous rigor, my dear friends. Now we are talking about this image. If you see this, you can see the grass particles. What you can interpret it? If you are seeing grass particle, that means person tried to save himself. Person tried to save himself. That means person was alive. Alive person used his ATP. So there was decrease in ATP. Decrease in ATP lead to the rigor mortis. Decrease in ATP lead to the rigor mortis, my dear friends. So grass particles are there. That means sign of struggle. This is struggle sign. That means person tried to save himself, but in the end he died after the struggle. Grass particle, mud particle. So these are cadaveric spasm. Commonly seen changes in the cases of drowning, death, especially in the ante-mortem origin. Ante-mortem word means person was alive. Person was alive. Person was alive. Death happened in the water. Death happened in water. That means person was alive. Now manner of death is, death can also be known by this. You can also know the manner of death, my dear friends. So how to know the manner of death? If grass in the hand is there, that means drowning has happened. If weapon in hand is there, that means suicide. If you see the grass particle like you have seen here, sir, if grass particles are there, that means in drowning. If weapons are there, that means this is a case of suicide, my dear friends. Coming to the next, heat stiffening. Muscle changes ke andar. Now we are going to see the heat stiffening. Heat stiffening, you take an example of egg. When egg is there, raw form, it is in the liquid. When we increase the temperature, the protein inside the egg will coagulate and they become stiff. Same is happening with the muscle also, my dear friends. So heat stiffening, coagulation of muscle protein due to increase in temperature, and temperature specifically you need to remember more than 65 degrees Celsius, my dear friends. Then coming to the next one is cold stiffening. You see there are different type of fluids inside the body. If those fluids become ice crystal, how the movement is possible? No, not at all. So remember guys, gas stiffening, cold stiffening, temperature less than -5 degrees Celsius, you need to remember. Body fluids become ice crystal. Joints cannot move and body becomes stiff, my dear friends. Body will be stiff. So cold stiffening. Fourth type of stiffening, what we have to discuss right here is gas produced during the decomposition, resulting in the stiffness of the body. Stiffness of the body, gas produced during the decomposition. Hydrogen sulfide. Hydrogen sulfide is a gas which is predominantly produced, my dear friends, during the decomposition of the body. Now coming to the late changes. Next topic is late changes, and in late changes we are going to discuss about the decomposition, putrefaction and the autolysis. We all know decomposition is external changes of the body. Putrefaction is the internal changes of the body. Autolysis is the lysis by the own enzymes, my dear friends. Now we moving on to the next, putrefaction. So bacteria, putrefaction is the internal change. What is putrefaction? Putrefaction is nothing but the internal change, my dear. Putrefaction is nothing but a internal change. So putrefaction, you will see bacteria, Clostridium welchi. Enzyme is lecithinase. Enzyme is lecithinase, my dear friends. So putrefaction, the bacteria is Clostridium welchi. Enzyme is lecithinase. First organ to be putrefied would be the larynx and trachea. The first organ which is putrefied would be what, sir? Your larynx and trachea, followed by liver and lung, followed by last organ putrefied would be the bone, my dear friends. The last organ which is putrefied would be your bone, my dear friends. But remember, late, if you talk about the late, yes, the word is late. Late in male, and on the other hand you write late in female. Late in male and late in female. Late in male is prostate, and late in female is nulli. Female is nulli parus uterus. What do you mean by nulli parity? Nulli parity means she never get pregnant. She never get pregnant. Done, sir? So these are the things you need to remember right here, sir. Now we talk about the decomposition. Decomposition again, bacteria is Clostridium welchi and the enzyme is lecithinase, my dear friends. Now first change if we see. Sir, the first change is the greenish discoloration of the right iliac fossa. So right iliac fossa you will observe, right sir, right iliac fossa you will observe that there is a greenish discoloration because there is a maximum activity is at the cecum. And what is produced there? This greenish color is because of sulfur hemoglobin, my dear friends. So here also you will see in summer and in winter. In summer, in winter. So sir, in summer if we talk about, in summer it is 12 to 18 hours. In winter it will take 1 to 2 days. Why? In summer there is a heat. Whenever there is a heat, the biological reactions will happen fast. That is why in summers it is earlier and in winter it is bit delayed, my dear friends. Second change externally, you are going to see the marbling. Start in 24 hours and prominent within 36 to 48 hours. What is happening after that death? Your vessels become prominent because your body is shrinking. And because of shrinking of the body, your vessels will become prominent. And their color will change into the reddish green color this time. Reddish green type of color, and that too because of the sulf hemoglobin, my dear friends. So marbling, you will see, if this is a body, you will see on the body, you will see the pattern like this. This is what called as marbling. And marbling is starting 24 hours after the death. After 24 hours of death, you will see the body start shrinking. Moment the body start shrinking, your vessels will be prominent and there will be sulf hemoglobin, because of which your vessels are now looking what's a reddish greenish in color. Done? Now third thing you will see right here is a maggot formation. Maggot formation. What is maggot? Maggot is larva of fly. So you will see insect growing inside the body. Normally the maggot formation is seen within 2 to 3 days. Normally the maggot formation is seen within 2 to 3 days. But in the rainy seasons, maggot formation is seen within 1 to 2 days. Study of maggot is called as entomology. What is the study of maggot called as? Study of maggot is called as entomology. The study of poison in the maggot is called as entomotoxicology. Entomotoxicology, my dear friends. Chalo. Now the fourth change, if we talk about the predominant gas which is produced, always I told you it is hydrogen sulfide. Hydrogen sulfide. The predominant gas which is produced during the decomposition process, remember it is hydrogen sulfide, and gas in skin result in the blister formation. So after death there will be a blister formation also. Now important term right here is Casper dictum, rate of decomposition. How you will tell the rate of decomposition? It was actually given by the Taylor. Taylor said air, water and soil, 3 mediums are there where the rate of decomposition is very much different, my dear friends. If body is kept in air, my dear friends, if the body is kept in air, then it will take 1 week for the decomposition. If a body is kept in water, it will take 2 weeks for the decomposition. In soil, it will take 8 weeks. So ideally, you should remember like this: air, then there is water, then there is soil. Air 1 week, water 2 weeks, soil 8 weeks, my dear friends. Now, postmortem luminescence. Luminescence, remember, light coming out from the dead body due to photobacteria and the fungus like Armillaria and ram's bottom. So don't get afraid by seeing the body if body is like spreading the light. This is called as luminescence phenomenon, and that is because of the photobacteria and fungus like Armillaria and ram's bottom. Done, sir? Now modification of decomposition is there, and what are those? Number one thing is Adipocere. Modification is there. This is Adipocere. Adipocere is also called as saponification. It is seen in warm or humid climate. Warm or humid climate mainly, my dear friends. The enzyme is lipase. The enzyme involved is lipase, and the bacteria involved would be the Clostridium welchi. Now the fat, what is happening right here, sir? The fat in a body is converted into fatty acid, and conversion is only happening because of the warm humid climate, plus your enzyme, plus your bacteria. The enzyme is lipase, the bacteria is Clostridium welchi. So remember, the fat is converted into fatty acid, then it is binding with the calcium. And this binding of calcium with the fatty acid will lead to the formation of adipocere. Will lead to the formation of adipocere, my dear friends. Smell of adipocere would be garlic in nature, my dear friends, due to palmitic acid and oleic acid, etc. Time required to form the adipocere, 3 to 4 days in India due to humidity, because warm and moist climate is the requirement right here. Fresh adipocere is soft and moist in nature, color is whitish color. But if old adipocere is there, my dear friends, the nature would be yellow, hard and brittle. If you see soft, moist, white, that means fresh adipocere. If yellow, hard and very hard, brittle is there, then it is old Adipocere. Now what are the medico-legal significance? The question comes here. That is a complete area of interest. Medico-legal significance, if we talk about the climate of the body, you will come to know. Time since death, yes. Lysis of the body is slow. So identification of the body is for the longer period of time you can do. So these are the three important medico-legal significance of the Adipocere. Second thing we need to learn right here, sir, is mummification. Mummification is seen in the dry and the hot climate, not warm and the moist. It is dry and hot, completely hot. And it is drying and dehydration of the body, because in the hot climate what will happen? The complete dehydration will happen, my dear friends. And smell is odorless, and time required is 3 months to 1 year, my dear friends. This is all for the mummification. Coming to the next is embalming. If we talk about the embalming, artificial method of preserving the dead body is called as embalming. So two important method we need to understand right here, that is artificial injection and cavity method. Artificial injection in the, where it is given in the femoral artery. We use different chemicals to be injected in the body. Now cavity method must be done within 6 hours of the complete postmortem. Before postmortem it is not allowed to do this. Always done after knowing the cause of death. After postmortem, after knowing the cause of death only, you are allowed to do this. If embalming is done before knowing the cause of death, it is punishable under IPC 201. Punishable under IPC 201, my dear friends. Embalming fluid, my dear friends. Embalming fluid, if we talk about embalming fluid, one is phenol, methanol, glycerin, formaldehyde, sodium chloride and water. Phenol, methanol, glycerin, formaldehyde, sodium chloride, water. These fluids we can use for the embalming. These fluids are what, sir? Embalming fluids, my dear friends. Now sodium citrate also we can use. Yes, sodium citrate we can use. Method of injecting embalming fluid is discontinuous method. This method is called as what, sir? Discontinuous method. We give, we stop. We give, we stop. We give, we stop. Continuously you cannot. Okay. Embalming. Artificial method of preserving body is called as embalming. So for embalming there are the two methods. What two methods we are having? So one, we are having an artificial method in which injection is given in the femoral artery of the different fluids we are using in that, and another is cavity method. This must be done within 6 hours of completing the postmortem, and without knowing the cause of death, this is not allowed. Only after knowing the cause of death, you are allowed to do the embalming, my dear friends. Other than that, embalming is done without, if you do embalming without knowing the cause of death, then you are punishable under IPC 201, my dear friends. So these are the embalming fluid, my dear friend: phenol, methanol, glycerin, formaldehyde, sodium chloride, water, sodium citrate. But remember something. What is their purpose? If we talk about the, like this, if I draw like this, right, friends. So you will see first is preservative. Preservative. Who is preservative? If I see here, preservative is formalin or methanol. Then coming to the next is germicide. Who is germicide right here, sir? Germicide is phenol. Then coming to the wetting agent. Sir, who is wetting agent? Wetting agent is glycerin. So next one is buffer. You need buffer also right here, sir. So buffer we are having sodium borate. Sodium borate. Then coming to next things, anticoagulant. So as anticoagulants, we will be needing the sodium citrate. Then sir, we are having a dye. Which dye we will be using here, sir? The dye which we are using here is eosin. Then the last is vehicle, and that is none other than the water, H2O, water. So these things you need to remember right here, sir. Other than that, remember something here, the method of injecting the embalming fluid is discontinuous method, because you cannot just continuously push, no. Push, stop, push, stop, push, stop, push, stop. Remember, the best time would be less than 6 hours. And best injection technique we already know, that is discontinuous method. Best vessel, if someone asks you best vessel, then your answer would be carotid or femoral. Carotid or femoral. Best vessel will be what, sir? Carotid or femoral. Okay. So this is where we have completed chapter number 5. Thank you so much, my dear friends.